The sooner you can get the results, contact tracing can begin immediately. And I noticed what you're doing in Australia. It's quite remarkable and very fantastic how you're serious about contact tracing and following up right away, quarantining. And that's so important to knock this virus down flat on its back. And we did it back in March in California, and then everything got lax and easy going and opened everything up too fast again. And now we have the largest number of infections in the entire United States, more than New York.
Florida is a real problem.
Florida is a huge problem. They have the largest single day number of infections of over 15,000 people infected each day on the average, at least the last couple of days that's happened. And that's even much higher than New York. New York is way down now in terms of daily infections. And Florida, Texas, and California, the big three, as Dr. Briggs called them, three New Yorks. We have three New Yorks on the horizon right now. Not on the horizon, it's actually in place right now. And that's a major, major problem for fighting this virus and getting the economy going again by first fixing the virus problem, not jumping the ship and doing it too soon with the economy.
Healthcare in the United States has long been an issue. Well before COVID-19, it's been a political issue. And how is the system coping?
It's not a good system that should have been in place when this pandemic hit. We needed a comprehensive, universal system, as you have in Australia and other countries in Europe have. All over the world, in many cases, they have universal single-payer or government-sponsored, employer-sponsored systems. But everyone is covered. Everyone has access. And that way they can put health clinics out in the public. Testing facilities to be expanded immediately. Centrally planned directive on public health could be implemented. In the United States, we're not able to do any of those things initially, and that's one reason we skyrocketed this way in terms of infections. And we became the largest country in the world to be infected, largest number of people infected, because of the lack of an adequate comprehensive healthcare system. That has to be immediately worked on as soon as possible, actually.
And the bottom line is, as a byproduct of that, the stats are there's a disproportionate amount of those socioeconomically challenged, those in black communities, those Hispanic communities, are so highly represented in the numbers, particularly those that are dying.
It's staggering. I mean, if you look at the number of, in California alone, the percent of people who are dying is 45% Hispanic. And the number infected is 55% Hispanic or Latino. And that's way above the numbers of the population itself. So it's just horrendous that it'd be a disproportionate impact on these communities that are already, many of them in the lower moderate income range of income. And it makes it much more difficult. Multi-family, multi-generational families where young people can bring it back to their parents. And you don't have contact tracing or massive testing that we should have. So this is so important. The healthcare system has left 30 million Americans uncovered right now. Even with Obamacare, there was going to be 20 million uncovered. And we need to move toward a major national healthcare system, whether it's insurance or full implementation. The British model or the Canadian would work very well for us. That had to be in place, and that would have helped us a lot with this COVID crisis.
Just changing tack a little bit as the world rushes by. We are in July, November is the election. How's the president going?
It's quite remarkable for an incumbent to be in this situation. Of course, he's facing something that no other incumbent has faced, is a worldwide pandemic. But he basically took it easy and denied it at the beginning. He didn't really want to jump on it back in February or January when he first heard about it, and put off the response, unlike many other countries that had tackled it right away and brought the numbers down to close to zero right away. That's why the European countries could open up their schools in May, because they had knocked down their numbers almost to zero. We kept escalating, and now we're about facing whether or not to open the schools in the fall, which is a very dangerous situation, to send kids into public schools and even private schools on campus. Now, the governor of California said no public school opening this fall coming in September. Instead, we got to wait till October at least to see what goes on. But other schools, like some of the private schools, are talking about opening up halfway on campus and have half the students online. You cannot. We never studied student situation yet. Students have been out of school since March, so we don't know the infection rate. We do know the latest study out of South Korea says that the students who are between 10 years old and 19 years old infect adults and infect other people just as often as adults infect each other. 10 years old to 19, that's the majority of the school students. So it's a very dangerous situation right now, and presidency is having to deal with that, and I wish that they had dealt with it earlier. His popularity would be much higher right now. His numbers are very low. You know, he's only got about a 42% approval rating overall in all the polls. Some of them are down to 39%. Biden's up at 53% support. So the president will lose this election unless he can turn this around. He's only got almost less than 3 months to do it.
Do you think he will?
Well, he's changed his tone of voice. When you spoke yesterday, he said, this is a big pandemic. It's a big problem. We have to start wearing, taking care of preventive measures. I guess he's coming out asking people to wear masks now, finally. And he's also wearing it himself. But I don't know if he can turn it on soon enough in time, because these numbers are still going to keep going up because the baseline is so high right now. And that's the problem, Tim. The baseline is high, and so more people get infected more quickly because of the large number of people already infected here. And he's got a lot of work to do to try to get this done, but he has to be serious and to really put resources behind it as well. And I think it's going to be very challenging for him. If I had to predict right now, at this point, if people voted today, he would lose the election by quite a bit.
And a bit of a drama with China as well.
Oh, yes. I mean, that is so uncalled for, because this is the world's largest, second largest economy, China, and the biggest trading partner with the United States, one of the biggest. And that is going to have a major impact, as already has had, with the president bringing those trade wars, tariffs on China, and now going after China for its internal policies, and creating a lot of hostility. And he's trying to get other countries in the world to line up against China and to criticize China. I think a lot of it has to do with his election prospects. And other countries are saying, well, Mr. President, you always talked about America first. How are we supposed to be partners with you right now on China? And frankly, China is, we don't need to have another Cold War. We have to ameliorate the circumstance and negotiate and be diplomatic about this situation between the two world's two largest economies. Most countries want to do that. So he's got a real problem on his hands now in that sense, too.